Mike, don't worry about me cutting Laura off. I do it all the time.
Oh yeah, I'm used to it. And I talk so much, if you don't cut me off, you might not get a word in.
You're not nearly as bad as you think you are.
Okay, that's because I'm deliberate about it on these shows. Just spend some more time with me.
She's like, strap in.
Challenge accepted. Covered the whole gambit from their mental health to like our mental health. I think that's really
I thought that was important.
I like the order you have it in.
There are parents that deal with both. Yeah. So I'll just kick it off again. Episode 2. We're back. This is fun. Mike Carey is our guest today. Welcome. Good to have you, sir. If you want to give us a little synopsis of who you are and how many children and or child do you have and their age range.
Sure. My name is Mike Carey. I humbly work on a project called The One Good Reason. It's just basically tackling a lot of things, topics that we might take for granted or might have been raised to believe, whether that be religion, a plethora of various superstitions, or even any new age tropes and things that are coming out nowadays. To give an example, we might talk about, Pizzagate. That might be something that might come up, or we might talk about, authority and subordinates, consciousness, free will, determinism, all of those types of conversations. You typically can't walk up to somebody in the street and ask them, hey, what are your views on apology, for example, without getting tased or pepper sprayed. So we kind of do that from the safety of our homes, allowing people to kind of engage in armchair-esque philosophy and speculation. I do have a daughter. She is 6, and I do have some background in working in a mental health clinic, both in the United States Air Force for a little over 4 years. And then I also have background in working in a psychiatric residential treatment facility for both adults and adolescents, which I would arguably say was more intense than the military aspect of it, for the most part. But yeah, that's pretty much who I am in a nutshell.
It's a healthy range of, older kids and younger kids with you parents. So I wanted to kick it off with a general discussion. Since the discussion is concerning mental health, I wanted to discuss both within your own children, if you recognize it, and within yourselves, if you personally want to share anything about yourselves. But by all means, you're not obligated to. But one of the questions I did have is whether yourself, if your own children exhibit mental health problems, or if you know of any other friends, family, caregivers, parents of their own that have children that have mental health problems. And if so, how and what ways have you observed them being cared for, or how the caregivers or parents care for their children?
I have my daughter's 13, and she has ADHD. So, and that's pretty common anymore for that to be a diagnosis. I probably have ADHD too. I haven't been diagnosed with it, but I feel like I have some of the symptoms that she has, that she was diagnosed with. And one of the things that I can appreciate so much more about how I learned to deal with that as a parent is how bad my parents dealt with it when I was, because there was a stigma about mental health stuff when I was growing up. So you didn't want your kid to have mental health problems. That was, a social shame. So being able to recognize how unhealthy that was for my development gave me the opportunity to try to, do a little bit better for my kids.
I think aside from the social shame, it was just poorly understood. And it was, it always came off as an excuse, or it was portrayed as an excuse to behave poorly, to not learn, on track at school,
Yeah.
or to not pay attention, and it's, and there was a lot of, at least in my house, it was, well, if you can't pay attention, or you can't do this, well, if you just hit them, then they'll learn to listen, or if you just take their toys away, they'll learn to listen, or if you stick them at the table long enough, they'll figure it out. And so that was the way that it was dealt with, back then by a lot of parents.
Yeah, a lot of behavior control. Yeah.
And so like you said, learning how not to do it is a really good lesson on how to be better.
Yeah, and it's interesting that you pointed that out, Justin, because I think I've had a very similar experience to Bree, where like I have a child who is neuroatypical. We're not sure exactly what it is yet, but ADHD was what we first suspected. But he and I both have the same symptoms, and I have been struggling with it my whole life. I think it's closer to a form of autism or an anxiety disorder than ADHD, only because I've had so much opportunity to learn about all of those diagnoses now, and that they have a lot of overlapping symptoms, but they're completely different things.
Mm-hmm.
And it really does take a lot of digging deep to figure out which one's which. But it's interesting because I've gotten to 38 years old because I've learned a lot of different forms of masking and coping that I can do most of the time and can't do some of the time, but I get by, right? So even when I fail, it's like, oh, well, that's Laura. She's just different. It's cool. It's okay. Especially with family and friends who are close to me and know my different quirks, right?
Do you see the same coping mechanisms in your child that you use?
Not as many, but he's been homeschooled since he did kindergarten and first grade in public school, and all the rest has been homeschooled. So a lot of the issues that would disrupt his daily routines, we work with them, right? So he gets fidgety when he works. We allow him to stand up while he works. We allow him to take breaks. We allow him to have a toy with him at the table, because we're talking, one kid instead of 20, and it's not as disruptive within our sort of learning environment. And it can be, don't get me wrong. Like there are days where he just melts down and can't get things done, or, he's asked to write a simple paragraph and it's the end of his world, so we do have our moments, but he hasn't been in a situation where he's forced. But even today, he got in trouble multiple times just because his behavior was so what's the word? Not spontaneous, but like impulsive, right?
Yeah.
So he would run into family members or go into a room making random noises, and not realize or even think about the fact that he's being disruptive. I don't want to say he gets punished for it, but he gets a lot of Caleb stop, Caleb don't, Caleb stop, Caleb don't, right? And like there's a point where you kind of feel like you're not validating your own child because that child is so different from all the rest of the children and so different from other children in his peer group that he kind of gets treated differently, and it really it becomes really difficult, right, to watch him get treated differently than everybody else. I kind of went on a little bit of a rant there, but it's complicated, because it's such a different situation.
I find a lot of what you're saying relative to my youngest child. He's so much different than the older two, and has different behavioral quirks and struggles. So he has a lot more struggles than what they had when they were his age. But it's trying to work within the confines of what he's willing to do. He has they call oppositional defiance disorder, which he's starting to grow out of. It was more of a problem when he was younger, but that's basically, when the more you push them to do something, the more they resist when they have that diagnosis. So trying to find a way to make the education stuff, especially, be something that he chooses to do instead of something we're making him do, has been a real challenge. With
my daughter, you can probably hear her in the background now. She's amazing in many ways, right? But when we're talking about behaviors that maybe we would think could be improved on, such as like communication or just following tasks, like Brainbug was saying, there are things where she'll just kind of steamroll like for example, if she wants to watch something on TV, she'll march out to the living room, she'll pick up the remote, and she'll flip the channel to whatever she's wanting to watch, only to hear a, what the heck, I'm sitting on the couch like, what are you doing? I was watching this. And she'll turn around and say, oh, I wanted to watch, such and such. So yeah, it's, your first instinct or reaction is, hey, don't, like Laura was saying, don't stop, or, hey, I was watching that. But I've kind of tried to make sure that I'm explaining perspective and point of view from other people. So that way it's not just some dictate, some blanket statement that I'm making. So I don't want her to have some kind of complex about, taking control and being proactive and being independent and watching TV. It's just having that situational awareness. And hey, if I was watching something, maybe I would like somebody to discuss that with me before changing the channel.
I have the same conversation with my daughter when she does that. She'll barge in or want this or want, oh, I don't want to eat the food that you're eating, the dinner, or I want to watch something else. And I say, look, when you're watching your iPad or you're watching your TV, do I go in your room and change it on you? No. Well, would you want me to? No. Well, then don't do it. And then if she does it continuously, I'll actually go do that. And I'll go and I'll just sit in her room and turn her TV like, hey, we're watching this now. This is cool, right? And
I never thought of that. That's pretty good.
She's 4, so like she'll revert back to certain behaviors, but after a while she's like, okay, well, I'm not going to do this because mom and dad are watching this show or dad is watching this show, and I don't want someone to do that to me. And like kids are really receptive, like far more than we give them credit for, even at a young age, as to internalizing the why, especially if it's like a 1-for-1. Like, I don't want this to happen to me because of this, and I don't want this to happen to me either because of this.
Yeah, and to be fair to my daughter, I was hogging the TV for most of the day, but that it's
hey, it's my TV.
So, but regardless, it's if she's noticing I'm having a poor behavior, right, she should have those skills to, or I'd like to present those skills and ways to communicate that somebody's performing in a way that you don't approve of, etc. So she has I think gained a lot. I'm not even doing it justice, but she still has some anxieties and things that we've picked up on, especially when someone is telling her something that she completely messed up on. Like there was no, let's say you were supposed to put this thing here and you put it in a different place. It's just black and white. It was not correct. When she's being told like the opposite of what she thought she was supposed to do, she'll like grab her earlobe, which is kind of like a self-soothing mechanism. So I'll notice that, and lately I've been trying to get her to realize when she's doing that, and to ask her, does that make you feel better, or do you notice when you're doing that? But at the same time, I don't want to make her feel, in such a way, self-conscious of, am I doing that thing again that my dad pointed out? So it's kind of, how do you bring up the behavior without maybe having a backfire effect where you're making it worse, or adding another instance of negativity that you weren't intending?
That's something that we've been navigating at my house, where my daughter will go into these tantrums and throw a fit and start screaming and crying a lot, and I would like stop her and say, hey, what happened? Like, why are you crying? And she would kind of eventually explain it, and I say, hey, I understand that you're frustrated, but I mean, is this something that we should cry about, or something we should be frustrated about and get angry over? Well, no. And I'm like, I don't know where to go from there, because you can recognize that it's not something you should be angry about or get really frustrated or stomp and throw or whatever, but you do it anyway. It's not like you choose to, become a screaming mess. It just happens, right? So I think just over time, it'll kind of get better. But my biggest lesson, over the past couple of years is just don't expect, like reason and rationality to take hold for quite some time, and
like
just do your
25
best
years.
to yeah, just do your best to be encouraging, and try not to stifle too many actions, even if they're annoying or negative, or if they put their shoes in the wrong spot or their coat in the wrong spot, it's not that big of a deal in the long run.
My two, they're very different. My son's is being pre-diagnosed with autism, although we're still waiting for the full diagnosis. Interestingly, the school have been really, really crap with it. It's almost that we've really struggled with the school, and my wife works with children with additional needs, older children, but she really pushed for the school because she recognised the kind of telltale signs, and she really had to push. But the school were really resistant to it because with kids who've got autism and additional learning needs, they have to put extra resources in place. And they didn't want to do it, and it was as simple as that. But it's interesting watching because me and my wife are both really busy. We both have quite intense jobs where we often work overtime. And when we get the children together in the house, they kind of rely on each other a lot of the time for attention because we're doing other things, and it's interesting watching the dynamics, and like Justin's daughter, my daughter has the kind of tendency to play the crying game when she wants to, and it's not always a case of it is a natural instinctive reaction. She knows what she's doing. She's very she's very switched on with it, and it's interesting to watch the dynamics between the two because my little boy he will do anything for anyone. He really will do anything for anyone. Aww. To the point of a fault sometimes. And as he gets older, it does get more concerning that is not willing to kind of back down from that. I know that sounds strange, but back down from that kindness. It's like it's so innocent that you kind of dread him going into the real world as he gets older, in case he's manipulated. And the dynamic between them is so interesting to watch. And again, my daughter's one of those who she'll sit at the dinner table. I'm not eating this, and the tears will come. So yeah, the dynamics between watching them is very, very interesting, especially when you've got one with additional needs and you've got one who hasn't got additional needs, but kind of plays on it because she doesn't get all the attention that she wants.
It's good that you're putting pressure on the school because I guarantee there's other children there that have the same needs, and they're just not being met, and they're not even trying.
Well, and sometimes I wonder, in regards to the school thing, just how educated everybody is in every school district about things like autism and ADHD, because we have these spectrums where you can present some symptoms and not others. It could be very subtle. You could be masking. It could be something where they just think, no, that child is just being defiant and they know what they're doing, but really it's some sort of other impulsive disorder that's going on in their head that they can't control. It's very, very subtle sometimes. So when the average person thinks of autism, they think of nonverbal and they think of highly handicapped. And not all autistic people are so highly handicapped. Many are very high functioning. And I think that is something that our society is still trying to wrap its mind around. The fact that, no, you as the layperson really don't know everything there is to know about ADHD, right? or autism or whatever it is. So I wonder if with the school district, if they see a child who's generally falls within the normal ranges of most things, but then has these little behavioral problems or learning problems here and there, that they're really resistant to label that child, which I think, like Richard said, it does them a disservice. But I think that's kind of still where we're at. I think we still have a ways to go before people say, oh, okay, I might not know everything about this. Let's give you the resources you need to figure it out.
I mean, it's come a long way since I was at school. I was at school in the 80s. And it's the only kind of thing you saw in the 80s were that they recognised dyslexia. And that was literally it. Out of all the range of things, that was all they recognized. And even then, there were no real extra support for the kids who had it.
Yeah, in my schools, there was just a separate classroom that they put all the people with what they called learning disabilities, people who just couldn't grasp the standard material. They put them all in a separate classroom and basically just babysat them and gave them remedial work and just passed them every year. You simply did not learn everything that you were expected to know when you graduate high school. It was really just trying to get people processed through to meet metrics or numbers or whatever it may be.
Trying to piggyback on what Justin was saying, it just made me think of the lack of effort, or I should say the percentage of effort seems to deteriorate once they realize that the individual might have more of a need for effort. As counterintuitive as that sounds, it's like, well, let's just say Justin's IQ is, a lot less than the people here for whatever reason, one way or the other. It seems like if the teachers are walking into that scenario, they're feeling like they don't need to try as hard. There doesn't need to be as much effort. When obviously it should be the opposite. I remember being in school and, knowing some kids that would go into those types of classes that just kind of seemed like, babysitting rooms, as you said, or like kind of daycares, walking with them to the class and then seeing them go in there and just kind of thinking to myself, like, well, what are they going to be doing today? Are they cutting out a picture? Or, I mean, it's not specialized to the individual. It's just kind of this lumped,
You would think that some of this type of babysitting type stuff stops at like elementary or middle school, but they funnel you into high school, well, here, and then you get kicked out because you can't really fit in. You don't have the skills, both educational and social skills. And then they send you to alternative schools, like a whole separate school system that has virtually no standards. And then you get pushed through the pipeline there until you graduate. And then you're no longer, the responsibility of the state anymore. Granted, with the resources available, that's very likely the case, but they basically push you forward until you get yourself removed and then give you these alternative options that are virtually worthless in terms of actually getting a foundational education. And it's happened to my brothers. Both of my brothers went to alternative schools, and I know a lot of people that have. And you just don't get the knowledge that you're expected to have.
I was working with adolescents, right, in a residential treatment facility where these kids are basically, the parents put them in this kind of, it's going to sound kind of harsh, but it's kind of a lockdown facility where everything's very structured, from their playtime to the meals to chores to bedtime, even the showering situation. And, me as an adult coming in to supervise among maybe 2 or 3 others with some orderlies and nurses, just kind of seeing the difference in that type of environment, as sad as that might sound, that they have to be in that environment, but each individual had their own progression. They had their own goals, and you could see real progress. And you could open anyone's chart and see, okay, these are the triggers for that person. These are the things we're working on. This is how they performed yesterday, and things of that nature. Just again, in public school, I wouldn't imagine anything that's even close to that. But not everybody has the money, let's say, to put them in some fancy, facility. So.
I appreciate all of you individually captured exactly what I wanted you guys to capture, because it's all about recognizing the signs in your kids and trying to find the appropriate resources where you can direct help for them. And so when you find yourself when you see that you lack the resource and help and support from your children's schools, and then you are pretty much more or less strapped to, find other additional resources, because those more privatized, institutionalized schools are way more expensive, or more than anyone can really afford. I wonder if you take that, lack of support and make that your own onus to own, because I wonder if you just feel kind of hopeless in a sense. I cannot only imagine how a parent could not, striving so hard just to find the resources, just to not only support themselves, but you can't even support your own child.
That's really fucked up to think about. If you're a parent and you don't have the money to help your child, you're in a, as you said, you're kind of in a catch-22. What do? Do you just say, well, it's not my fault, I don't have the money, so we'll just have to do the best that we can? Or like, yeah, I don't really know how you would, there's all sorts of, funding and government grants and things like that, I guess. But yeah, I mean, at the end of the day, if you're not, if nobody's willing to do this type of work, like pro bono, so to speak, yeah, it just kind of puts you in a weird position where you're stuck with just subpar care, I guess is kind of the nicest way to say it. It kind of makes me think of that movie, The Joker, where they basically told him, we don't have any funding, so kick rocks. I know that's not a real person or anything, but yeah, that's a great point I think Jena brought up, is what's available in your area, let alone the stigma involved, and let alone the pricing as well. So
yeah, it comes down to like not just educational stuff, but medical needs, your pharmaceutical needs, all these things you have to take into consideration. You gotta work with your doctors and work with your with your doctor and the school on the same page. You got to get try to get maybe some counseling, we did occupational therapy for a while with one of my children. And not everybody has that opportunity. Sometimes you don't have any way to pay for that sort of service. And like Mike was saying, unless somebody's willing to go and do it pro bono, or you're able to get some kind of government assistance for that particular type of need, then you're just up the creek.
You mentioned doctors, and it made me think that, like, if you go into a hospital and you say, I have this problem, automatically it checks a box, and that box has like a cascading effect that leads to everybody around you knowing what they're supposed to do. There's a standard medical standard of care that everybody knows their part and knows what needs to be employed, what actions, questions, medications, how to triage it, everything, what procedures that follow. Like, everybody involved knows exactly what needs to be done. If you put your kid into a school and say, my kid has autism or ADHD, nobody has any idea what the next step is. It's just, and there's so much of the onus is on the parent to figure it out and talk to every single person involved that plays any part of it. It's not like it just triggers a thing where, okay, here's this form, here's this thing, talk to this person, we're going to send over this and all this and that. It's like, nope, here, just do some research and, we'll see if we can figure it out. It's
right. You got to become an expert on the condition if your kid has it, because you can't count on anybody else to know anything about it.
Yeah. I mean, you hear horror stories of patients that have to advocate for themselves. But that's what this is, right?
That even carries over into the general practices of medicine. Because when I took myself and my son in to be assessed, a lot of what the doctor said is like, oh, well, that's just normal behavior for a boy. Oh, well, like everybody goes through that. And I was like, I don't think you understand. Like, I don't live in a closet where I've never been around another human being, or I've never been around another child. Like, I can see where he contrasts with, and so it took a long time and a lot of like weeding out the conversation for him to finally be like, you know what, actually, you're right. There might be something more to that. Let me refer you to a specialist, right? Like, I don't know. I can't diagnose it. And I was like, I really am only here for the referral because that's how frickin' insurance works, right? I'm not here for a diagnosis. I'm here for the referral. But
block you.
It took a long time to get there. We were there in the office for a good hour and a half because his first assessment was people come in with problems and they're not really problems, right? Like, you're just overreacting. You're just like everybody else. Don't worry about it. And it's like, well, first of all, I've been around 38 years, and the things that I've experienced, I have the time and the experience to know what experiences I have that are generally normal experiences and what experiences I have that are abnormal or that or they're atypical or whatever you want to label it, right?
Atypical, yeah.
And I see how my what's that?
Yeah, atypical, I think you said correctly.
Yeah, atypical. And then I see how my son contrasts, not just with my other 4 children, right, but with every other child that he's around. I can see where he's different from everybody else.
You're like, I have a control group.
Yeah. So when I say he's impulsive, he's not impulsive like every other 11-year-old boy. He's impulsive like himself.
Yeah.
Or when I say that he randomly makes noises, he doesn't randomly make noises the way that a typical 11-year-old might sometimes when they're bored. He does it frequently and just, distractingly, and to the point where he contrasts with kids in his peer group, right? And so I think that we see it in the school systems where we still have a long way to go. But I think even in the medical profession, we still have a long way to go with doctors who have this old school way of thinking that people still fit in these pretty little boxes, right? They haven't quite caught on to the idea yet. And I'm not saying that's every doctor. People are going to have great doctors sometimes, but I just think that it's a slowly progressing social change that still hasn't made its way all the way even through the medical profession.
I feel like we grew up with a generation that there were people that didn't actually believe in mental health care, that it was a real thing that needed to be dealt with. It was my parents' generation. My wife's mother still doesn't believe that in the mental health care situation.
Wow.
The need for medication and stuff like that. It's still like, oh, rub some dirt in it, kind of.
Interesting.
Just get over it.
I think it was only recognized on the extremes, right? So like, either you're normal or you need emergency psychiatric care with lithium or something, right?
Exactly.
So
there's
only the extremes.
There's definitely that stigma.
The last few minutes or so, several of you have said something. I don't want to go off down a rabbit hole, but I just need to say universal healthcare, because
we're dancing around that quite a bit, huh?
all of you, pretty much everybody on the panel has said, "Oh, it cost me this much," and because I haven't had that because I live in a country with universal healthcare, and I can't even begin to imagine that extra pressure. The extra financial pressure on top of everything else.
No, that's a good point. You talk about the parent who cannot get their child the help that they need because they don't have the funds or the opportunity or the resources. That's absolutely unacceptable. And I agree with you. Like, the fact that's not even a concern in your country. And here we are, like 4 of the panel members talking about how prevalent it is for people to not. I know when we went to the appointment that we just went to, we had to pay cash because there was a hiccup in our insurance and they dropped us when my husband retired, right? Instead of changing the insurance type from one type to another, they just dropped us. And so we ended up having to pay cash. We're very fortunate, and this is a problem that will work out and it's not too big of a deal. But if that was our normal everyday experience, I couldn't consistently pay for those appointments all the time, cash. Like that adds up quick, right? Mm-hmm. Especially when they're, say, monthly or twice a month or whatever they end up being. It all adds up really, really quickly. And the fact that insurance is what gets between a person and their health, it's mind-boggling.
Well, even if you have semi decent insurance, these types of issues, especially mental health issues, we have to go over and over and over again. The co-pays alone are very, very expensive for a lot of people. Mine, if it's not like preventative or routine or something, I think it's like $35 or something, but it can be $45 or $55 every time you go see your doctor. even if the visit is covered, there's a copay that, like, every time you walk in the door and sign your name, here's a check. It's rough.
Yeah, I think Richard kind of hit it on the head there. I don't know why I didn't think of that either. That's kind of a good point there. With this thing that happened in Michigan recently, not to get dark here, but it's fairly recent in the news. I think that's a shining example of what Laura was talking about, right? Is here are these parents. Now, I don't know if they're just, oblivious to the kid's, situation. I would doubt that if they live with the kid, but whether they couldn't afford the care, or, whatever, or a combination of all of the above. But the outcome was, if for those maybe watching that aren't for whatever reason aware of it, there was he 15? He went into his school and he killed 4 students, shot a few more. And I think he was gifted a gun for one day or another. I don't know if it was his birthday or a holiday or whatever it was, but he was gifted a gun. And apparently, there were all these red flags. The school was even, I think, made aware of it at some point, but there was just no action done. So I think it's just a combination of even the school, sadly to say, and just only more investigation. Obviously, more information will come out. But I think from Richard's point of view, I could see, hey, if we have universal healthcare, that wouldn't even be an issue. It wouldn't even be. It would just be a Saturday. You would just take your kid to some professional, and then this could all get essentially nipped in the bud. Hopefully, knock on wood. If that were the case, if we did have some type of universal healthcare that didn't quote unquote bankrupt the economy, as everybody seems to be worried about, I highly doubt something like the Michigan shooting would have taken place, or at least it'd be less likely given all of the benefits and the opportunities that the parents would have, including the child themselves, if they wanted to just take themselves, skip school to go see somebody.
When we're talking about the mental health of children in general and getting outside of our own children and more into just culture-wise or society-wise, I'd like to stay there a little bit longer if you guys are cool with it, because I think that's a really, really big deal. Like, we've all kind of touched on, here's what we would do with our kids. And it sounds like we're all really caring and proactive parents. And it's interesting because you can still have a caring and proactive parent who's doing as much as they can, and they could still be missing mental health issues with their own kids. And so kind of having that conversation of the broader problem of children and mental health issues, I think it's really, really relevant. And I don't think it just boils down to the fact that we don't have universal health care. I think that's an answer to a different problem, which is the treatment, right? How do you, once you have identified that there's a problem, like you're cut and you need stitches, or you're sick and you need meds, mental health issues and you need.
There's a culture that runs counter to it, that says that you don't want to diagnose mental health issues in your child or in yourself, for that matter. You don't want to have those things that are bad, and if you do have them, don't tell anybody. Don't let anybody find out about them. There's just, it's always been that way, at least here in the area of the U.S. that I live in, and I'm really working to try to peel away from that. So I'm glad to see that I'm not alone, and there's a whole panel of people here on the same page as I am.
No, Bree, you nailed it. That's exactly where I was going to go, is like, before we can even start to talk about what to do about these mental health issues, is just destigmatizing them and getting them out in the open and letting people know that it's okay. Like, what if something like ADHD or people on the autism spectrum are actually a lot more in the normal range of behavior than people realize, but so many people have been masking and been given these different behavior controls, whether it's punishment or just behavior modification or whatever it may be. What if we were to find out that actually all this neurodiversity is a lot more normal, and that it's actually the normal person that's in the minority? Like, people just don't function that way. We've just been taught to or conditioned to pretend like we do, right?
I suspect it is. I suspect that is the case, because as most of you know, I am incredibly old. And watching the span of like, since when I was like young in the early 80s, or like growing up in the early 80s to now, and nobody had any kind of outside of the ordinary. Yeah, the diagnosis, it was nothing. And if anybody did, it was like they were still using words like crazy routinely. And,
even in the 90s, when I was a kid, Ritalin was about it. That was about the only treatment that for any kind of behavioral issue with children at all, Ritalin.
And that was for the outliers. That was for the kids who had the worst symptoms, not for the kids that were just kind of struggling to get by but still needed help. But, you can pass your classes, though, and you're smart, and you can sit and focus. Therefore, you don't need the Ritalin. But that kid is still suffering, and that kid is still having a hard time getting through their school. They just happen to be high performers.
Maybe developing some bad coping mechanisms, too. That's what I run into with a lot of, me too. So I feel you.
Yeah. I saw a video recently. It was called The Exceptional Child is a Special Needs Child. And I was watching it and I was like, oh my gosh, I think a lot of my anxiety disorders and stuff that I have today come from when I was younger and I was told I have to behave a certain way and told I have to fit into a box and told I have to, ignore this and squelch that and don't show this. And so yeah, I graduated with honors. I was an exceptional student. I was in the GT program and my life was difficult and I was constantly suffering from anxiety. And had I been treated differently as a child, maybe not pushed to perform so hard, maybe not so many expectations on me, maybe allowed to make a little bit more noise, maybe I wouldn't have developed some of the coping mechanisms that I have today. I don't know.
I think some of the work that needs to be done now is recognizing those traits, because and I'll be perfectly honest, had I been a single parent, I probably wouldn't have recognized that my son was autistic. I probably wouldn't have noticed. It's only because my wife was trained in that area to begin with, because of her profession, that she picked up on those subtle hints. And I'd probably, now he's 8 years old, I'd probably still be thinking, in areas where he struggles with handwriting, for example, which is a symptom of his condition, I would probably still be thinking, come on, you need to try harder. Not because I don't care, but just because I wouldn't have recognized it as being what it is. So I think there is still, although we have come a hell of a long way from when I was young, there is still awareness that needs raising around the whole thing and around diagnosis and around spotting what the particular things are that those particular traits are in children.
I want to get your guys' take on something, if I may. And that's when to get help, whether it's for yourself or for your child, but maybe especially for your child, since this is a parenting show, when to get help for your child. My child's 11 and I'm just now getting him the assessments that he needs. And the reason I waited so long is his previous pediatrician in the town we used to live in said, all children are somewhere on some spectrums. So don't get him diagnosed unless it's something that gets in the way of his ability to function or his happiness or his ability to like be around other people, right? As long as he's happy and as long as he can function, don't worry about it. Like don't get him diagnosed. And at the time it made perfect sense. And that maybe involves a lot of stigma, like maybe don't get him diagnosed because of the stigma. Like, I don't know why his advice was that, but I adamantly disagree with it now. Just based on the fact that based on his advice, I waited so long to get answers that could have helped him out years ago.
Mental health is no different to physical health. If I break my arm, I need help for it. I need something doing. If I break my leg, I need something doing. If I get a good poke in the eye from Laura for speaking over her too much, I need to get that seen to straight away. And that's the same with mental health. As soon as you recognise that there's something there, you need that diagnosis so that you can put things into place and help move forward with that. It's no different.
You can wake up with back pain and it can just say, oh, I just slept wrong, or my leg hurts, right? Or I've had this pain for months and months and months, and I'm just waiting for it to go away. I don't need to go see a doctor, and that's very common to have these physical ailments. And if it doesn't like completely ruin your day or stop you from doing your job, we're really good at ignoring them, especially the stubborn people among us. Some people just go straight to the doctor. They're like really concerned, but we're really good at ignoring physical issues, the same mental health issues. For me personally, I treat it almost very the same way. if my issues, whether it's really poor attention span or getting spaced out all the time or losing track of time or unable to focus or being fidgety, as long as it's not like ruining my career, I just ignore it until like it slowly starts doing that. But I don't agree that that's how we should treat our children. We should be better than that and learn from, our own experiences that there's nothing wrong with getting help earlier, and they shouldn't have to deal with it. Like as an adult, if you were not diagnosed, if you had something and you're just kind of living with it and you're okay with it, that's one thing, but we should give the children a choice or a better chance of dealing with these things earlier on.
At what point is it neglect to your child, though? Because, I mean, they're struggling in school because of some mental barrier that they were dealing with. I mean, that's one thing. But if it's just something that's making them struggle socially and maybe, like Laura said, diagnosing them may come with its own stigmas that then drive them to struggle socially. So, it's walking that tightrope of how much of getting this treatment is going to help my child versus cause more social issues for them. Where do you draw that line at?
Yeah, I think the heart of Laura's question, right, or not question, but the scenario that she brought up with her healthcare provider, it's kind of like the emperor's new clothes, right? Where if you mention, hey, by the way, you have diagnosis X to the child, do they internalize that as I am this diagnosis, right? And it sounds like I'm not trying to be devil's advocate. I'm just trying to get in the mind of that healthcare provider. It sounds like they were maybe concerned that could cause a byproduct, right? Or because we explained the autism, let's say, or the ADD of the child, now the child is depressed, right? Because they have this other diagnosis. But I disagree with that reluctancy to begin the journey to heal, right? The patient, the child. It's just kind of it doesn't seem like a strong enough argument to, well, there could possibly be a negative aspect of educating this person about what's going on. So therefore we should just ignore it altogether or delay, because as Bree was saying, they're in school and they're struggling. And if it comes out later on, right, that you could have done so, you know what I mean? And it's kind of, it just sucks, because we're in a position as a parent trusting the healthcare provider. And if they don't really have a good reason as to why, or they don't explain why they think we should delay acknowledging a particular diagnosis, I think there's a hell of a lot more repercussions, more detriment to the patient than benefit in the long run. So again, I don't think that they're justified, but I think that, yeah, they were probably thinking, what if this causes an additional, negative side effect? A lot of conversation I have with my daughter, kind of for those blind spots, as we're talking about here, is, just asking what types of things is she worried, what type of things is she worried about? What is she currently thinking about? If I notice that she's pausing or delaying and doing something, like, what are you thinking about right now? Sometimes she says, well, I don't want to mess up, or I don't want to make a mistake. And I say, well, you have to basically try it, and then, you can see what you did. And that's kind of how we learn how to do something. So I just want her to basically understand there's going to be that struggle in trying something new, or sometimes I don't think she believes me that, I've gone through something similar. But I think that's just good to kind of take that temperature as to, on a daily basis, like what are you thinking about right now? The best I can do is just try to get on the same playing field with her and say, yeah, Daddy can't sing, but I've done karaoke and people laughed at Daddy. If you want to sing a song and you were in the car, don't feel embarrassed, or just, go for it. But I think that's the best we can do at those early ages, is just keep trying to take that temperature with the child, and just let them know that you're just like them, or you were at some point, as unbelievable as that may be. So it's just one take. This is the okay. This is the Mike Myers one take. Okay, sounds good.
Yeah, we're on the Deadpool plan with maximum quality with minimal effort.
So far, we're doing all right.